Hi, Dave Rhine, back to talk to you. I missed you last week. I was away on a holiday backpacking in the Rockies to Mount Robson. If you've never been there, you need to go. It's a World Heritage Site. It's an unbelievable, spectacular place. Starting with rainforest, ending with a glaciated lake, varied terrain. The only thing that's unpredictable about the whole thing is the weather. So I'd like to talk to you today about this article about misconception related to concussion. First thing I'd like to say is there is no pregnancy test, as I have often said, for concussion. There's no single test currently available to diagnose concussion, so it's based on the story and the onset of symptoms related closely in time. These symptoms cover 4 possible domains, and usually more than one domain is included. So there's physical symptoms, there's cognitive or thinking symptoms, the way your brain works, there's emotional symptoms, and there can be sleep changes. So there are often symptoms in all 4 categories. There are other common conditions that can cause similar symptoms and can confuse the situation, particularly whiplash-associated disorders or neck sprain strains. And of course, they often coexist with concussion. In the future, we may see or specific objective tests for concussion may be developed and may be available. And let's hope that happens in the near future. There's lots of progress being made in that regard, but right now it's a condition that's diagnosed by taking the history from the patient and by examining them. So if you're worried about the possibility of concussion following some kind of injury event for yourself, then go get checked. Stay away from activities where there's a risk of recurring head injury. Go to someone who's skilled and experienced in these assessments and this diagnosis. That's important. And when you enter treatment, go to an experienced healthcare provider. Our PACE app is great at giving you information about concussion, and it's great at getting you started on the right treatment pathway. But it's to be used in conjunction with your primary healthcare provider, so never leave them out of it. Go get involved. Go get help if you need it. So take care. Talk to you next week. Have a great long weekend.